Hello and a heartfelt welcome to Dr. Marcus's Health Haven, where we talk openly, compassionately, and honestly about the health issues that matter most to you. I'm Dr. Marcus, and I'm truly honored to be your guide today. We're about to explore a topic that is often swept under the rug, especially for older men, but one that can deeply impact your well-being, your energy, and even your longevity. Yes, today we're diving into the surprising health benefits of masturbation for men over 60. This is a judgment-free zone, a space for truth, science, and personal empowerment. If you've ever felt unsure, embarrassed, or even ashamed about this topic, you're not alone. But you also deserve clarity, confidence, and the freedom to thrive. So if you're passionate about aging with strength, dignity, and vitality, please take a moment to hit the like button, subscribe, and drop a comment below about what healthy aging means to you. Your voice helps this community grow, and your health is worth talking about. Let's get started. Why this matters more than ever. As we grow older, our priorities shift. We want to feel good in our bodies. We want clear minds, strong hearts, and the ability to move through life with confidence. And while we often focus on the big three, diet, exercise, and sleep, there's one powerful, natural, and science-backed practice that's often left out of the conversation: masturbation. Yes, it's a sensitive subject, but it's also a completely normal, biological, and potentially life-enhancing part of healthy aging. Today, I'll walk you through 7 major benefits, debunk some harmful myths that have held men back for decades, share multiple real-life patient stories that will open your eyes and give you practical, safe tips you can use to support your longevity. Starting today. But first, let me address something I see in my practice every single day. Men over 60 walking into my office with shoulders slumped, avoiding eye contact when certain topics come up. They've been conditioned to believe that sexual health is somehow inappropriate at their age. That couldn't be further from the truth. Your sexual health is intrinsically connected to your overall health, your mental clarity, your emotional balance, and yes, even your lifespan. I remember James, a 74-year-old retired engineer who came to see me last year. He was dealing with depression, sleep issues, and what he called just feeling disconnected from everything. When I gently brought up the topic of sexual health, he actually laughed and said, "Doc, that ship sailed years ago." But that ship hadn't sailed at all. It had just been anchored by shame and misinformation. 6 months later, after implementing what we'll discuss today, James told me he felt more alive than he had in decades, not just physically, but emotionally and mentally too. Benefit 1: Heart health and blood flow. Let's begin with your heart, the engine of your entire body. Cardiovascular disease is one of the most common concerns for men over 60, but here's what many don't realize. Sexual activity, including masturbation, supports heart health. A 2016 study published in the Journal of Sexual Medicine followed over 900 men and found that regular sexual activity was associated with lower blood pressure and a reduced risk of heart attack. Here's why. Masturbation gently increases your heart rate, similar to light exercise. It improves circulation, helping blood move efficiently through your arteries. And during orgasm, your body releases endorphins and oxytocin, which lower cortisol, the stress hormone linked to inflammation and heart disease. So when you engage in regular healthy sexual activity, you're not just relieving stress, you're literally nourishing your heart, one of the most loving things you can do for your body. But there's more to this cardiovascular connection that most men never hear about. The nitric oxide released during sexual arousal acts as a natural vasodilator, essentially helping your blood vessels relax and expand. This same mechanism is what makes certain heart medications effective. You're giving your cardiovascular system a gentle, natural workout that can help maintain elasticity in your blood vessels as you age. I had a patient, Robert, 68 years old, who came to me with borderline high blood pressure. His cardiologist wanted to put him on medication, but Robert asked if there were natural ways to help first. Along with dietary changes and walking, we discussed maintaining sexual health. 3 months later, his blood pressure readings had improved significantly. His cardiologist was amazed. Robert winked at me and said, "Good thing we didn't tell him all our strategies." The beautiful thing about this natural approach is that it addresses multiple systems simultaneously. While you're supporting your heart, you're also boosting your mood, improving sleep quality, and maintaining hormonal balance. It's like a full-body tune-up that costs nothing and has no side effects. Benefit 2, prostate protection. Next, let's talk about your prostate, that small but mighty gland sitting just below your bladder. As men age, the prostate becomes vulnerable to conditions like benign prostatic hyperplasia, BPH, and prostate cancer. But here's some hopeful news. A landmark study from Harvard Medical School, published in 2016, found that men who ejaculated 21 or more times per month had a 31% lower risk of developing prostate cancer than those who ejaculated less frequently. Why? The theory is simple. Ejaculation acts like a detox for the prostate, helping to remove potentially harmful substances and reduce inflammation. Masturbation, of course, counts. It's not a cure, but it's a simple, natural way to support one of the most vulnerable organs in a man's body. Let me share a quick story. I once worked with a patient, let's call him Henry, a 69-year-old retired truck driver. He came to me after his PSA levels had slowly crept up. He was scared and frustrated. We discussed lifestyle changes, including his sexual activity, which had dropped significantly since losing his partner. After making gentle changes, including reintegrating solo sexual touch and pelvic exercises, his next blood work showed stabilized PSA levels and improved sleep. "I didn't think something so simple could make such a difference," he told me, "but I feel like I'm back in tune with my body again." And that's what this is about. Connection, not performance. Here's what's fascinating about the prostate research. Scientists believe that regular ejaculation helps flush out potentially carcinogenic substances that can accumulate in prostatic fluid. Think of it like changing the oil in your car. You're not just maintaining the engine, you're removing buildup that could cause problems down the road. But the benefits extend beyond cancer prevention. Many men over 60 struggle with enlarged prostate symptoms, frequent urination, difficulty starting urination, or weak stream. Regular sexual activity can help maintain healthy blood flow to the prostate region, potentially reducing some of these symptoms. It's not a medical treatment, but it's a natural way to support prostate health alongside whatever treatment your doctor recommends. I remember another patient, William, 72, who was getting up 4 to 5 times per night to urinate. It was affecting his sleep, his mood, his energy levels. Along with his urologist's treatment plan, we discussed maintaining sexual health. William was initially skeptical, but after a few months, he reported not just better sleep, but feeling more energetic and positive overall. I didn't realize how much everything was connected, he told me. The research continues to support what we see clinically. A 2019 study in European Urology found that men who maintained regular sexual activity throughout their lives had better prostate health markers and fewer urinary symptoms as they aged. The key word here is regular. We're not talking about compulsive behavior, but healthy, consistent sexual expression. Benefit 3. Emotional and cognitive well-being. Let's be honest, aging isn't just about the body. It's about the mind and the soul, too. Masturbation can be a powerful support tool for mental health. It triggers the release of dopamine, motivation, and pleasure, endorphins, natural stress relievers, and serotonin, which boosts mood and helps regulate sleep. In fact, a 2018 review published in Sexual Medicine Reviews found that older adults who maintain an active sexual life showed better cognitive function, lower depression rates, and improved emotional resilience. Feeling connected to your body at any age helps fight back against isolation, loneliness, and that nagging feeling of slowing down. You're not slowing down, you're shifting. And that shift deserves support, not silence. The neurochemical cascade that occurs during sexual activity is remarkable. Your brain essentially gets a natural cocktail of mood-boosting chemicals. The dopamine surge can help with motivation and focus. The endorphins act as natural painkillers and mood elevators. The oxytocin promotes feelings of connection and well-being. And the prolactin that follows orgasm helps with relaxation and sleep. This isn't just theory. Brain imaging studies have shown increased activity in regions associated with pleasure, reward, and emotional regulation during sexual arousal. For older adults, maintaining this neurochemical pathway can be crucial for mental health and cognitive function. I think about my patient Michael, a 71-year-old widower who came to me with what he called the blues. He'd lost interest in activities he used to enjoy, was sleeping poorly, and felt disconnected from life. Michael had been taught that sexual thoughts and activities were inappropriate for someone his age, especially after losing his wife. We worked together to reframe his understanding of sexual health as self-care. The transformation was remarkable. Within a few months, Michael was sleeping better, had rejoined his photography club, and even started volunteering at the local animal shelter. I feel like myself again, he told me. I had no idea I was shutting down such an important part of who I am. The research on sexual activity and cognitive function is particularly compelling for older adults. Studies suggest that the increased blood flow and neurochemical activity associated with sexual arousal may help maintain cognitive flexibility and memory function. It's like cross-training for your brain. There's also the psychological benefit of maintaining a sense of vitality and agency over your own body. In a culture that often treats aging as decline, sexual health can be a powerful reminder that you're still very much alive and capable of pleasure and connection. Benefit 4. Pelvic floor strength. You may not think about your pelvic floor, but I assure you it's thinking about you. This group of muscles controls your bladder, supports your prostate, and plays a role in sexual performance. As you age, the pelvic floor can weaken, contributing to urinary leakage, erectile dysfunction, poor bladder control. Here's the good news. Masturbation activates these muscles, giving them a low-impact workout. It's like a natural form of pelvic floor therapy, especially when combined with Kegel exercises, which I highly recommend. Try this. Contract the muscles you'd use to stop the flow of urine. Hold for 5 seconds. Release. Repeat 10 times. Do this twice daily, and over time, you'll notice better control, better confidence, and better function. The pelvic floor is often called the body's powerhouse, and for good reason. These muscles support your pelvic organs, contribute to core stability, and play a crucial role in sexual function. When they're weak, you might experience urinary incontinence, reduced sexual sensation, or erectile difficulties. But here's what many men don't realize. The rhythmic contractions that occur during orgasm provide an excellent workout for these muscles. It's resistance training for your pelvic floor, helping to maintain strength and tone. Combined with targeted exercises, this can significantly improve quality of life. I had a patient, George, 66, who was struggling with urinary incontinence after prostate surgery. He was embarrassed and had started limiting his social activities. His physical therapist recommended pelvic floor exercises, but George found them boring and hard to remember. When we discussed how sexual activity naturally engages these same muscles, George was intrigued. He began incorporating both approaches. 6 months later, his incontinence had improved dramatically, and he'd regained confidence in social situations. "I never thought pleasure and health could work together like this," he said. The connection between sexual health and pelvic floor function is bidirectional. Stronger pelvic floor muscles can enhance sexual sensation and performance, while sexual activity helps maintain muscle tone. It's a positive cycle that supports overall pelvic health. Research from the University of California found that men who maintained regular sexual activity had stronger pelvic floor muscles and better urinary control as they aged. The study followed over 500 men for 10 years and found significant differences in quality of life measures between sexually active and inactive groups. Benefit 5. Hormonal balance and testosterone support. This is a benefit that deserves its own spotlight. As men age, testosterone levels naturally decline, typically by about 1% per year after age 30. By the time you're 60, you might have 20 to 30% less testosterone than you did in your prime. This decline can contribute to fatigue, mood changes, reduced muscle mass, and yes, decreased sexual function. But here's what's fascinating. Sexual activity, including masturbation, can help support healthy testosterone levels. The anticipation, arousal, and climax all trigger hormonal responses that can help maintain your body's natural testosterone production. It's not a fountain of youth, but it's a natural way to work with your body's systems rather than against them. I remember David, a 69-year-old retired accountant who came to me feeling exhausted all the time. His testosterone levels were low normal, but he didn't want to jump into hormone replacement therapy immediately. Along with lifestyle changes like improved sleep and exercise, we discussed maintaining sexual health. David was initially uncomfortable with the topic, but he was willing to try natural approaches first. 3 months later, his energy levels had improved, and his follow-up blood work showed slightly higher testosterone levels. Not dramatic, but meaningful. "I feel more like myself," he told me. "I didn't realize how much I'd been sleepwalking through life." The research on sexual activity and hormones is compelling. Studies show that men who maintain regular sexual activity have higher baseline testosterone levels and better hormonal balance overall. The activity itself stimulates the hypothalamic pituitary gonadal axis, which regulates hormone production. There's also the psychological component. Feeling sexually vital and confident can reduce stress hormones like cortisol, which can suppress testosterone production. It's another one of those positive cycles where physical health and mental well-being reinforce each other. Benefit 6. Sleep quality and stress management. If you're struggling with sleep as you age, you're not alone. Sleep architecture changes as we get older, and many men find themselves waking up frequently or having trouble falling asleep. Sexual activity, particularly the relaxation that follows orgasm, can significantly improve sleep quality. The neurochemical changes that occur after orgasm create an ideal environment for sleep. Prolactin levels rise, promoting relaxation. Oxytocin reduces cortisol, your stress hormone. The combination often leads to deeper, more restorative sleep. Thomas, a 73-year-old retired teacher, came to me because he was tired of being tired. He'd tried melatonin, chamomile tea, meditation apps, but nothing seemed to help him sleep through the night. When we discussed sexual health as part of overall wellness, Thomas was skeptical. But after a few weeks of incorporating what we discussed, he reported sleeping more soundly than he had in years. It's like a natural sleeping pill, he laughed, but with much better side effects. The stress reduction benefits extend beyond sleep. Chronic stress is linked to virtually every age-related health concern, from cardiovascular disease to cognitive decline. Having a natural, healthy way to manage stress can be invaluable as you age. Research from Wilkes University found that people who had regular sexual activity had lower stress levels and better immune function. The study measured stress hormones and immune markers, finding significant differences between sexually active and inactive participants. Benefit 7. Immune system support. This might be the most surprising benefit of all. Sexual activity can actually boost your immune system. Research has shown that people who have regular sexual activity have higher levels of immunoglobulin A, an antibody that helps fight off infections. The mechanism involves several factors. The physical activity increases circulation, helping immune cells move throughout your body more effectively. The stress reduction lowers cortisol, which can suppress immune function. And the improved sleep quality allows your body to produce more infection-fighting cells. Carl, a 70-year-old retired engineer, used to catch every cold that went around his senior center. He was frustrated and worried about his health. Along with other wellness strategies, we discussed sexual health as part of immune support. Carl was initially amused by the connection, but he was willing to try anything. That winter, for the first time in years, he didn't get sick once. My grandkids were amazed, he said. Grandpa became the healthy one in the family. The research on sexual activity and immune function is robust. Studies have found that sexually active adults have 30% higher levels of immunoglobulin A compared to inactive individuals. They also show better responses to vaccinations and lower rates of common infections. Now let's address some outdated myths that might be holding you back. Myth number 1, masturbation is only for young people. False. Your sexual identity doesn't vanish with age, it evolves. It deserves just as much care and respect at 70 as it did at 30. Myth number 2, masturbation causes weakness or memory loss. There's zero scientific evidence supporting this. These ideas are rooted in cultural shame, not medicine. Myth number 3, it harms relationships. Actually, when done in the context of open communication, solo activity can complement and enhance intimacy, not replace it. Let me share another story that illustrates how powerful it can be to overcome these myths. Frank, a 75-year-old widower, came to me feeling guilty about having sexual thoughts and desires. He'd been taught that men his age should be beyond all that. Frank was dealing with depression and felt disconnected from his own body. We worked together to help him understand that sexual feelings are normal and healthy at any age. The transformation was remarkable. Frank's mood improved, his energy increased, and he even started dating again. I thought I was supposed to be a grandfather, not a sexual being, he told me. Now I realize I can be both. The truth is, sexuality is a core part of human identity that doesn't expire. It may change, evolve, and express itself differently over time, but it remains an important aspect of who you are. Denying or suppressing this part of yourself can have negative consequences for your overall well-being. Practical tips for healthy sexual aging. Here are 5 ways to bring this conversation from theory to practice. Listen to your body. There's no perfect number. Once a day, once a week. Go with what feels healthy and non-compulsive for you. Create a safe space. Your environment matters. Dim lighting, calm music, a locked door. These small things help reduce anxiety and improve the experience. Use body-safe tools. Choose lubricants that are non-irritating, unscented, and designed for sensitive skin. If in doubt, ask your doctor. Pair with healthy habits. Eat prostate-friendly foods like tomatoes, walnuts, and leafy greens. Move your body. Get 7 to 8 hours of sleep. These all work together to keep you strong. Talk to your provider. If you notice changes in libido, erectile function, or discomfort, please don't suffer in silence. Help is out there, and solutions are often simple. Let me add a few more practical considerations. Timing can matter. Many men find that morning or early evening work best when energy levels are higher and stress is lower. Don't rush. As you age, arousal and response may take longer, and that's perfectly normal. Use this as an opportunity to be more mindful and present in the experience. Consider it part of your health routine, like taking vitamins or going for a walk. This isn't about performance or achievement. It's about maintaining connection with your body and supporting your overall wellness. If you're dealing with physical limitations, arthritis, or other health conditions, don't let that stop you. Adjust positions, use supportive pillows, take warm baths beforehand. Work with your body, not against it. And remember, this is private and personal. You don't need to discuss it with anyone unless you choose to. This is about your health and well-being, full stop. A final word on shame and reclaiming your power. Here's what I want you to remember today. There is no shame in taking care of your body at any age. Masturbation isn't just a physical act. It's a declaration that you are still here, still vibrant, still human, and worthy of pleasure, connection, and joy. I've seen patients in their 70s and 80s come alive again, not from medication, not from surgery, but from reclaiming a part of themselves that had been buried under guilt or silence. You deserve more than silence. You deserve wellness. The shame that many men carry around sexuality often stems from outdated cultural and religious messages that have no basis in health or science. These messages can be incredibly damaging, leading to depression, anxiety, and disconnection from your own body. It's time to let go of shame that isn't even yours. I think about all the patients I've worked with over the years who've been transformed by simply giving themselves permission to be fully human, fully alive, regardless of their age. The 80-year-old who told me he felt young again. The 65-year-old who said he'd reconnected with joy. The 72-year-old who reported feeling proud of his body for the first time in decades. These aren't just medical success stories. They're human stories of reclaiming vitality, dignity, and wholeness. And that's available to you too. Let's continue the conversation. Thank you so much for spending this time with me today. If this message resonated with you, please give it a thumbs up, subscribe to my channel, and share it with someone you care about. The more we talk about this, the more we normalize it, and the more we help men thrive, not just survive. Tell me in the comments, what's one health topic you'd love for me to cover next? Or what's your personal tip for aging well? Your insight builds this community, and I can't wait to read your words. This is Dr. Marcus signing off with one final reminder. Your body is not past its prime. It's still your home. Love it, care for it, and let it surprise you. Stay vibrant, stay curious, and I'll see you in the next video.